Hi, my name is Dean Spraja. I'm CEO of Medical Fitness Solutions, and I'll be taking us through the Nautilus Strength Training for Older Adult certification. So let's start off with looking at the issues with individuals that are aging and loss of muscle mass. It's classified actually as a disease. It's sarcopenia. And we start to look at what the definition of sarcopenia is, and it really indicates to us how serious an issue this is because there's no broadly accepted clinical definition, consensus diagnostic criteria, codes, or treatment guidelines, but it is a progressive disease with a risk of adverse outcomes such as physical disability, poor quality of life, and death. So a little difficult to understand that it can't be classified, nor are there any specific treatment guidelines, but it can result in physical disability, poor quality of life, and death. So we're going to discuss what can be done about sarcopenia and what has been proven to work with older adults that are suffering from loss of muscle mass. So as people get older, typically you're going to see a degradation in the sequela of aging of neurological function and musculoskeletal function. And these happen typically concurrently as we age. And they can end up with the accumulation of catastrophic outcomes. So we lose balance and muscle mass and posture and bone density. Many times that can end up in a osteoporotic fracture, falls, etc. And the number one indicator of a fall is actually muscular weakness. There are several components in a fall reduction and fracture program, but the number one indicator of a fall is muscular weakness. Now I'm going to emphasize some points as we go through this because we're going to have a 25 question certification at the end of this presentation. So I'll give you some hints as to what may be on the test. So these folks in this nursing home have no underlying pathology. They're not paralyzed. They're just too weak to walk. And sarcopenia affects men more than women. But when we look at the sequela of aging in the musculoskeletal system, women have more issues with bone degradation. So we're all at risk as we get older. Remember that sarcopenia refers to the loss of skeletal muscle mass with age. And we're apt to lose 5 to 7 pounds of muscle tissue each decade of adult life. And many times this will be masked by gaining adipose tissue weight or fat weight. So we may not see our weight drop, but we see our body composition change as we get older. And this, again, many times contributes to falls, fractures, other disabilities. In a simple equation on gaining fat is calories in versus calories out. So too much fat is mainly caused by taking in more calories than you burn. Now, there are all kinds of nuances to that, but that's the simple formula. More calories taken in than used in physical activity in daily life. And there's numerous other issues that are exacerbated or caused from a health perspective by excess fat. And stroke and diabetes and various other diseases, including coronary heart disease, high blood pressure, some cancers. So a bevy of issues created with too much fat and not enough muscle. And one of the ways to categorize whether or not individuals are overweight is called the body mass index or BMI. Personally, I don't like it because it can be very misleading. People with dense muscles are going to show up as having a high BMI, even though they may have great body composition. So the little depiction there shows a person with a lot of musculature and a person with a lot of adipose tissue, but their BMIs are the same. And thin people, just from an appearance perspective, can be fat on the inside. They can have visceral fat, and visceral fat is stored around the organs. And interestingly enough, as many as 45% of those with normal BMI scores had excessive levels of internal fat. And among men, the percentage was nearly 60%. So this is unhealthy fat around the organs themselves, and that can be detected with MRIs. And just an example of an MRI scan, showing one with a lot of bone marrow adipose tissue and low bone mineral density, which is the bottom, and one with a small amount of bone marrow adipose tissue and higher bone mineral density at the top. And you can see the muscle mass is much greater with the top individual, even though the girth and the MRI might be the same. It's another cross section showing on the left more muscle mass. Both had the same body mass index, but obviously one has much more muscle mass, much less adipose tissue. There are other ways. MRIs are an expensive way to determine body composition, but there's DEXA, there's underwater weighing, which is a hydrostatic way, which has been a standard bearer for many years, but it's difficult with older people in particular to get them to exhale all their oxygen and to hold their breath underwater, basically with no breath. And then to change into bathing suits and be dunked is inconvenient, to say the least. Skin fold calipers are difficult to have reproducibility between users. And so those are difficult to get accurate readings. Bioelectrical impedance we'll speak a little more about. Of course, we touched on the body mass index. And there's some simple ones that correlate well, I believe. Waist circumference, the look and feel. And then one that doesn't correlate as well, again, is somewhat related to the BMI, is the bathroom scale. So waist circumference, simple. Men with a waist measurement of over 40 inches, women with 35 inches or more is indicative of health issues. And remember that may show up on the test as well, but kind of broad brush, but a pretty good correlation to issues with obesity and health challenges. Look and feel, just a self-assessment on a monthly basis, and sometimes it's difficult because you live with yourself on a daily basis. But can you do things as well? Are you as strong this month as you were last month? Do you look as muscular as you did last month? And really, probably the gold standard here is, do my clothes fit the same today as they did last month? The look and feel is, to a certain extent, subjective, because you can certainly create, on the look perspective, a false positive or negative, depends on your self-image as well. Bathroom scale is going to tell you body weight, but not body composition. Again, it's similar to BMI. You're going to get a gross number, but a much more accurate depiction is going to be done with one of the other methods, including the MRIs, the DEXAs. Kind of middle of the road would be bioimpedance, where we'd look at a 4-quadrant small electrical charge that follows a path of least impedance and puts together an algorithm that calculates body composition, both the fat, weight, hydration, muscle mass, and also BMI. And these are relatively reliable, relatively reproducible unto themselves. So these are some that we recommend and use as well. The great thing about, if there's a great thing about loss of muscle mass is, regardless of age, it can be reversed. So it's a modifiable cause of frailty, and it can be reversed by high intensity progressive resistance exercise. And remember that. And high intensity is not high intensity interval training. It's high intensity progressive resistance exercise, which is slow, controlled exercise where we're occluding the muscles from oxygenated blood and creating an anabolic effect in that muscle. And the other benefit, of course, of putting on muscle mass is muscle mass is not inert like adipose tissue. It's active. It creates a need for calories. It increases basal and active metabolic rates, burns more calories, and helps control fat as well. So our strength training program really is based upon a foundation established 25 years ago, and we're putting this program together here in 2020. And it's based upon a couple of exercise sessions a week. And the foundation is 6 exercises on 5 machines. And what we want to do is do slow, controlled, proper biomechanical movements over the entire range of motion. We want to occlude the muscles from oxygenated blood. We want to get to momentary failure and lactate. And then when we can reach that without the momentary failure with good biomechanics, then we want to increase that weight. We want to progress. And one of the major considerations, of course, is the risk of injury. We want to eliminate or minimize that. And the protocol that we use does that. And we've used this method for, as I mentioned, the last 20 plus years, well over 3 million resident patient treatments, 1,000 facilities, 0 reported injuries, thank goodness, and lowered cost of care. So eliminating the risk of injury, and then we want to isolate the musculature, create enough tension on the muscle through the entire range of motion that it occludes oxygenated blood, and that's typically 40% or more of the muscle mass involved to cause that restriction. When we do that, we fake the brain out, tries to get oxygenated blood into that muscle so it doesn't become ischemic. And when we release at the end of the exercise session or that set, the tension on the muscle, that oxygenated blood flows into that muscle again. And when we go to sleep at night, we have a memory of that challenge to the muscle, which creates the anabolic effect. So the goal is increase muscle mass and capillary density. There's a couple of real beneficial effects to that, as I'll go over. Cadence is critical, and I'll emphasize this too. So as I mentioned earlier, 0 reported injuries because we don't get ballistic. We're not throwing weights around. We're working with older people, slow, controlled movements, keeping the muscle tension, not clanging the weights at the bottom or the top of the range of motion. We recommend a 3-second concentric, a 1-second pause, and then a 5-second eccentric. And that gives us about 8 repetitions and a little over a minute of muscular tension. But that can be 10-second repetitions, concentric, eccentric. It can be a little faster, a little slower. The main thing we want to do is keep tension on the muscle. So we build up a little lactate in there, and I explain to clients that we're not looking for orthopedic pain. That's not the no pain, no gain we want. We want lactate. We want to occlude that muscle from oxygenated blood, and that's the goal there. So I'm going to bring up a little video clip that explains how we create that tension. Demonstrate for you the best way to create muscle growth safely within an older population. The keys are really isolation and inclusion to create that anabolic effect. And how we do that is really dependent on the load. We have proper load, at least 40% of the muscle mass of the isolated muscle group occluded from oxygenated blood for the entire range of motion. We want to fake the brain into thinking it's not getting oxygenated blood into that area. which creates the eventual anabolic response. We want to make sure whatever machine we're using is creating that tension through the entire range of motion. We want a slow cadence so the weights don't become ballistic, increase the propensity for injury. And we want to discuss with the user that there's a difference between orthopedic pain and lactate pain. We want to get to temporary muscular failure. So in order to do that, we use machines that we want to do full length range of motion. We recommend a 3-second concentric and a 5-second eccentric, with the weights never being lowered all the way. So we want to keep tension in the muscles throughout the entire range of motion. A 3-second concentric and a 5-second eccentric. And most clients, at the appropriate load, will feel lactate burn 30, 40 seconds into that exercise. And if we're using a timer, which many times we do, is 8 repetitions, about 63 seconds. So that seems to be a good duration when we're going slow and full range of motion exercise. We're going to lactate buildup will create that anabolic effect and get increased muscle mass and capillary density as a function. Okay, let's look at the various components and what the particular exercise, what we hope that result will be functionally. So major muscle group is quadriceps, glutes, hamstrings, and that facilitates getting on and off of chairs, on and off of commodes or toilets, on and off of the bed, leaning over to pick things up. A lot of function is around strengthening lower extremity musculature. And the triceps press, that's a good compound complex movement that, again, facilitates on and off of chairs, commodes, toilets, beds, etc. It's also a good catch musculature. If you're using a walker or supporting yourself, having strong tricep, then it goes into the pec a bit too, and front deltoid helps protect individuals as well. But using these muscles in conjunction with the legs on and off of chairs is key. Seated row is scapular abduction, and the intended outcome is improved breathing through better posture, reduced round shoulderness. So we want to, a lot of things that we're doing here is posterior musculature. When we look at this scapular abduction, this mid row, we're going to do back extension. Those help open up the thoracic cavity and improve posture as well. One of the key components, again, and they're all key in their own way, but low back pain is an indicator of fall risk as well. When people have low back pain and getting in and out of chairs as they change their posture, to avoid that pain, and many times will change their center of gravity and create instability and falls. But it's critical, and we've got some good studies I'm including with your PDF overview of this program, and a study from the Spine Zone Neurological Group, that the isolation and occlusion of the rectus spinae and hip stabilization is critical in eliminating back pain. So we want the knees above the hips, we want the hips stabilized against the lordotic pad, and we want to isolate erector spinae. This is an exercise that's overlooked in virtually every facility, and I think some of it is a function of fear of injury. But with proper biomechanics, you can isolate, occlude, hypertrophy, sternocleidomastoids and paraspinals to keep the head in an upright posture and position. And that has benefits across the board in PT, OT, and speech. So forward flexion and extension. 2 of the 6 exercises we have in the basic format for senior strengthening happen to be with the neck. And then part of the PDF, I'm going to also provide for you a little study guide, a 16-page PDF on one of the first studies done with this program. We're looking at pretty remarkable increases in functional independent measurement scores. Remember that FIM, functional independent measurement score. But in the one study extrapolation, we see a pretty remarkable reduction in cost of care based upon patients, residents having better functional independent measurement scores, and that translating into more efficient activities of daily living and lower cost of care. FIM score scored from 1 to 7, and the higher the score, it's the opposite of golf, the better it is. So we want to get individuals as independent as possible, and there is an objective way to measure that, and that's the functional independent measurement score. And again, this is extrapolated a little bit in the PDF we're providing for you as well. So when it boils down to, we've got a safe, effective, non-intimidating, somewhat subjective, but isolated weight stacks with dial technology, and a cost of care reducing program that's been proven over the last 20 years. In addition to the strength training benefits, and I borrowed these slides with his permission from Dr. Wayne Westcott, who presents on a regular basis, American College of Sports Medicine. But when we train properly, when we isolate and occlude musculature, we increase capillary density, we increase heart rate during that exercise, and we're getting benefits of traditional cardiovascular exercise without doing traditional cardiovascular exercise. So we're reducing blood pressure, we're reducing bad cholesterol during this, we're increasing capillary density, and those are all huge benefits that are attributed to proper strength training as well. So strength training is a key component to healthy aging, no doubt. But when we look at a fracture reduction program, there are other programs, products, intervention that help minimize that propensity as well. And that could include balance training, that could include bone density, osteogenic loading, whole body vibration for subconscious proprioceptive response, gait analysis, and gait training as well. But really the cornerstone is muscle mass and strength. So we like to get a baseline on individuals. Body comp gives us that baseline, and then we can measure, are we moving the needle? We really can't do that with BMI or bathroom scales because muscle weighs more than fat. If we're putting on muscle mass, it's not going to be indicated. We need to look at it a little more granularly, and we can do that with body composition analysis. And the best way to change it is through proper strength training. We get the huge cardiovascular benefit, and we're asking for 2 20-minute sessions a week. Typically, the older people are doing it in street clothes, and that's the synopsis. So let's move on. We can study the PDF that's attached as well, and then let's take the test. Thank you.